So, our group is the Widow Support Group, and today we want to discuss why we created this group. So, we recognized a clear need within our church, the local community, and among our individual clients. Many grieving spouses were struggling in silence and lacking a safe space to process their loss with those who also understand what they're going through. And so, this group that we are creating offers both therapeutic support and the power of community, which will provide a place to heal, connect, and move forward together. Today, we want to talk about the screening process and our theory. And two important parts of the screening process are one, the informed consent, which includes potential members need a clear understanding of the group's goals, topics, interventions, and confidentiality rules. It should be looked at as a two-way interview of both the client and the group leader on discovering if this group is a good fit for both involved. Another important concept is a pre-group interview, and this is the screening process that is a one-on-one interview and allows the therapist to assess the individual's needs, goals, interpersonal skills, as well as determine if the group is a good fit. So, the purpose of screening is to prevent potential harm to group members. A good question for the group leader to ask is, will this group be productive or counterproductive for the member that they are interviewing? There is a certain type of individual who might not benefit from group therapy and should generally be excluded from our textbook by Gerald Corey that states, group members that are in an extreme crisis or who are suicidal or have sociopathic personalities, highly suspicious or lack in ego strength, and are prone to bizarre behavior should generally be excluded from the group. When the leader is interviewing a member, they should look for members that would be willing to engage in self-exploration, in self-disclosure, and be willing to take feedback. Um, some additional questions that the group leader can ask is, does this person appear to want to be a productive group member? And will they be able to attend to the group's main tasks and goals? So those are a few of the steps required during the screening process.
So prior to beginning the group, we will hold an informational session, and this will just help introduce the therapy group. It will give an overview of the purpose, which is to offer support, strategies for coping, and then create connection among the people who are facing similar grieving experiences. The people that attend the information session will learn about the structure of the group. We'll talk to them a little bit about cognitive behavioral therapy, and then they will have the opportunity to ask questions and share interests prior to committing to the group. This meeting's purpose is to create a welcoming environment and help the participants to feel informed and comfortable before the group begins. We will also give a group readiness questionnaire, and this will just make sure that us as the therapists understand who is signing up to be a part of our group. This will be distributed to potential participants. And it was designed to assess their emotional readiness, their current support systems that they have in place prior to therapy, the goals for their participation, and then their comfort level, what they're okay with sharing and what they're okay with not talking about in a group setting. It will also help to identify any immediate mental health concerns that may require individual or personalized support plans before joining. Their responses will help to guide us to ensure that everyone is safe and we can support them adequately, and then we can tailor the group experience to meet their needs.
I'm going to address a little bit about the screening process of our group. So before joining the group, each potential member will go through an individual intake session with the group facilitator or facilitators. And we will use a brief assessment tool, such as the inventory of complicated grief, to assess the grief severity and screen for any risk factors, such as suicidal thoughts, unprocessed trauma, or anything that may require individual therapy outside of the psychotherapy group. The inclusion criteria will include adults experiencing grief due to a significant loss who are not currently in crisis. It'll include active substance abuse, untreated severe mental illness, or current suicidal intent. And these individuals will be referred to more appropriate services after the screening. We will also implement some ongoing assessments. So throughout the group's duration, we will use informal check-ins and mid-group evaluations to monitor participant well-being and the group dynamics. At the end of the group, we will re-administer the group inventory to assess progress and provide feedback. These ongoing assessments help tailor the sessions and ensure participants are receiving meaningful and lasting support. Lastly, I want to address some common misconceptions about grief groups. One common misconception is that grief follows a fixed timeline or a set of stages. Many believe individuals should be, quote unquote, over it after a certain time or after a certain amount of phases. And our group challenges this myth by validating each person's unique grieving process. Another myth is that grief groups are only for those who've lost immediate family, but we can welcome, we're dedicated to the loss of spouses. Additionally, people often expect group sessions to be emotionally overwhelming. While sessions can be intense, they are also structured to be supportive and paced according to participant needs.